Community Health Resource Center is in the heart of San Francisco, and we're on a mission to support the health of our community. We've been around for 40 years. There's always been a need for behavioral healthcare services. There was a dramatic increase at the time of the pandemic in 2020, and that's remained consistent. About 1 in 5 individuals in the United States aged 18 and older struggle with mental health illness.
I find that many of our clients come to us after really struggling to find quality mental health care in the area. Many clients, by the time they call our office, are already in crisis or close to it. Our wait list has grown quite a lot. We're seeing more referrals, more kind of complex cases that are coming to us.
After the pandemic, a lot of the ways in which mental health services were offered shifted to be primarily virtual. That has been a challenge for a lot of patients. And so one of the really great things about CHRC is that we do accept Medicare, have a really generous sliding scale, and we're also able to have licensed providers see patients in person.
And they'll also have access to a social worker, a therapist, additional consultation from a psychiatrist. And so it's very much like we are holding the patient together. When I outreach people, I hear so much gratitude and emotion behind some of those calls because people are just really happy to be able to be connected with a therapist. Sometimes when people enter my office for the first time, they have been suicidal for years. In our work together, seeing them want to live and make that decision that that's something that they want is life-changing. Therapy is life-changing.
We serve well over 10,000 individuals, and that number is growing every year. The Community Health Resource Center for the past 20 years has been providing an opportunity to train the next generation of behavioral healthcare providers. We want to formalize this process. Those licensed providers can then supervise the next generation of interns and associate clinical staff. The long-term impact of the Advanced Learning Program plants the seeds for multiple generations to support a pipeline of behavioral healthcare providers.
My experience has been really meaningful. I'm really inspired by my team. We're always in a collaborative care setting, and being able to learn from each other and be open to ask questions and reach out to each other for support is really important because that's part of the direct learning experience.
School does a great job of teaching us the theories, but integrating it in practice is where a lot of the growth happens. And CHRC does an exceptional job of being able to give patients to MSW interns such that they can put into practice what they're learning in school.
The consequences of not having behavioral healthcare providers impacts not only the individual person, but their families and the community. Community Health Resource Center is positioned to become the organization that can close the gap on behavioral health needs. With your help, we can close this gap together.